You know how sometimes you hear about a scientific thing and think, right, I should probably get the lowdown on that.
Hmm.
Well, today we're tackling Helicobacter. Now, you might have heard of Helicobacter pylori, in human health
Oh,
circuit.
definitely. Big news a while back.
Exactly. But we're zeroing in on what these bacteria actually do in our dogs and cats.
Right.
We've got a stack of scientific bits and pieces here, and our goal is simple. Just pull out the key facts, the crucial insights, and understand what these tiny organisms might mean for our furry family members.
Yeah, let's do it.
So let's sort of park the human stuff for a bit
Big idea.
and dive into the canine and feline world of Helicobacter.
Exactly. And it's important because the discovery of H. pylori and, its link to human stomach problems, that was huge, a real game changer.
Right.
But, and this is key, the Helicobacter story for dogs and cats, it's quite different. We're talking about a whole family of bacteria, Helicobacter.
SPP, meaning species, multiple types.
Precisely. Multiple species. And they're microbes that like low oxygen environments.
Yeah.
We call them microaerophilic.
Okay.
They're gram-negative, technically speaking, and they have this neat trick. They produce an enzyme called urease.
Urease, got it.
And shape-wise,
Yeah.
they can vary. Little round cucoid shapes, curved ones, spirals, a bit of variety there.
Okay, let's unpack that a bit then. So in humans, H. pylori can really disrupt the stomach lining, right? Mess with acid production, cause inflammation.
Yes, that's the classic picture in Peter.
Is it the same kind of, well, gastric mayhem in our pets?
Not exactly. What's fascinating and maybe a bit confusing is that in dogs and cats, it's actually pretty common to find several different Helicobacter species just living
They
together.
have multiple types at once.
Yep, in the stomach at the same time. And while we do sometimes see inflammation or maybe some changes in the stomach glands when these bacteria are around, the link isn't nearly as clear-cut as it is with H. pylori in humans. It's not always this, like, direct cause and effect thing.
Ah, okay. So the key insight there is just finding Helicobacter doesn't automatically mean there's a problem brewing.
That's a really important point, exactly. Presence doesn't equal disease in this case, not necessarily.
That's good to know. So just because they're there doesn't mean trouble. But do we have any clues about when they might cause issues? Any specific situations?
We do have some hints. They come mainly from experimental studies.
Okay.
So when researchers deliberately took H. pylori in another species, H. felis, and introduced them into specific pathogen-free cats, so really clean lab cats.
Right, controlled environment.
And also notobiotic dogs, basically germ-free dogs. Well, those animals did develop issues. Things like gastritis, which is stomach inflammation, an increase in immune tissue, lymphoid follicles in the stomach, and other immune responses too.
Ah, so that suggests, okay, under certain conditions, maybe if the immune system reacts a certain way, they can contribute to disease.
That's the thinking, yes. It suggests the potential is there.
Okay, so the stomach is kind of the main battleground, it sounds like, but our sources also mentioned the liver and intestines. Do these bacteria ever, go beyond the stomach?
That's a really important question, actually. And it's something scientists are still actively looking into. We know that things called Helicobacter-like organisms, or HLOs.
HLOs, look like Helicobacter, but maybe aren't confirmed?
Sort of, yeah. They look and act similarly, might not be fully classified yet. Anyway, these HLOs have been found in the large intestine and also in feces,
Okay.
both in healthy dogs and cats and also in ones with diarrhea. So their role in the gut, still a bit murky,
Right, unclear.
But perhaps more significantly, one specific species, H. canis, has actually been isolated from the liver of a dog that had hepatitis.
Wow, from the liver itself.
From the liver, yes,
Oh.
which points to a potential link, at least in some specific cases, between these bacteria and liver disease in dogs.
Okay, that's crucial then. Helicobacter isn't always just a stomach bug in pets.
Precisely. That's a key insight.
Liver involvement, definitely not the first thing I'd think of. So, just to recap, the systems affected. We're mainly looking at the GI system, stomach, potential gastritis, intestines, maybe linked to diarrhea with H. canis.
Right.
And then this hepatobiliary system connection with acute hepatitis linked to H. canis.
That's a good summary.
Right.
Now, you're probably wondering, just how common are these things?
Yeah, exactly. Are we talking rare or?
Well, the numbers are actually
Yeah.
quite striking. Gastric HLOs, those stomach ones, they're highly prevalent, really common.
How common?
In both dogs and cats. Studies show they can be found in a large percentage of perfectly healthy animals.
Really? Healthy ones?
Yep. And also in pets that have issues like recurring vomiting.
Yeah.
We're talking figures like 67 to 86% in healthy dogs.
Wow.
And even higher in some cat populations, maybe 86% or more in random source cats, 90% in healthy ones studied.
That's huge.
It really highlights how widespread these bacteria are. They're just on around.
Okay, those are surprisingly high numbers, especially in seemingly healthy pets. What about the ones who are showing signs? Like you mentioned recurrent vomiting. Is it higher in them?
Well, interestingly, the prevalence in dogs and cats with recurrent vomiting is also quite high.
Right.
And the ranges, they often overlap quite a bit with the ranges found in healthy animals.
Huh. So finding it doesn't help much distinguish sick from healthy sometimes.
Exactly. It reinforces that idea. Just finding the bacteria doesn't automatically mean they're the culprit for the illness.
Okay.
Now, if we switch to that enterohepatic side, the liver intestine thing with H. canis, that seems much less common. It was found in about 4% of dogs in one large evaluation.
Only 4%. Okay.
And actual reported cases of associated hepatitis, even rare. Just that single case highlighted in the info we have.
Right, that one case. So it really sounds like a lot of pets are just carrying these bacteria around without any obvious problems.
That seems to be the case, yes.
So who is more likely to get these infections? Is it like an age thing or maybe certain breeds?
The information we have suggests that gastric infection, the stomach one, often happens when they're young.
Young animals.
Seems that way, yeah. And remember that one case of the dog with H. canis-related hepatitis?
Yeah.
That was a very young puppy, only about 2 months old.
Oh, tiny.
As for specific breeds or, a genetic link, there's currently no strong evidence pointing to particular breeds being more susceptible.
Okay, so maybe young age is a factor for getting infected initially. Now, thinking about the pet owners listening, what are some signs? Things that might make you or your vet think, maybe Helicobacter. Keeping in mind, of course, that many pets show nothing at all.
That's the tricky part, isn't it? That asymptomatic nature.
Yeah.
Often there are zero outward symptoms, but when they do appear, they tend to be quite general GI signs. Things like vomiting, decreased appetite, what we call anorexia, maybe some abdominal discomfort or pain, weight loss.
Yeah.
And those tummy rumbling sounds.
Borborygmus.
That's the one, borborygmus, in dogs, particularly with H. canis. Diarrhea has also been noted. And in that single severe case of liver involvement with H. canis, the poor pup presented with vomiting, weakness, and unfortunately, sudden death.
Oh, wow. That's serious.
Very. It's also worth mentioning that the physical exam by the vet is frequently totally normal.
Really?
Yeah, unless the pet is maybe dehydrated from all the vomiting or diarrhea.
So the takeaway is the signs aren't specific. They could point to lots of other GI issues, too.
Absolutely. Very non-specific signs.
Right, okay. So if a vet does suspect Helicobacter, which specific species are they usually looking for? You mentioned there are different types in dogs and cats.
Yes, there are several that pop up commonly. In cats, in the stomach, you often find H. felis, H. helmani, and H. baculiformis.
Okay, cats. Felis, Helmani, baculiformis.
Correct. In dogs, the list of the stomach is a bit longer. It includes H. felis again, H. pizzozeroni, H. salomonis, H. helmani again, H. belus, also something called Flixus biropini, and H. cetogastricus.
That's quite a few for dogs.
It is. And then if you look at fecal samples from dogs, you might find H. bilus, H. canis, that's the one linked to the liver issue,
Right.
H. cynati, and Flixus biropini again.
And cats in feces.
H. cynati was found in one cat's feces, but honestly, we don't really know the significance of that yet.
Gotcha.
And as we said, H. canis was the species in that one dog's liver infection case.
So it's a diverse family of bacteria, clearly, but the crucial insight is we're still figuring out which ones are like the real troublemakers versus just bystanders.
That's a great way to put it.
Yeah.
Exactly. Which ones are pathogenic versus just commensal or opportunistic?
It's quite a lineup. Are there any known risk factors, things that might make a pet more likely to pick up these infections?
The main things that come up in the information we looked at relate mostly to the environment.
Like what?
Things like poor sanitation and overcrowding, kennels, shelters, situations like that.
Okay. So conditions where transmission is just easier.
Precisely. These conditions can make it easier for the bacteria to spread from one animal to another, likely through fecal, oral routes.
That makes sense. So if a vet suspects Helicobacter might be involved, how do they actually diagnose it? You said ruling out other stuff is really important first.
Absolutely critical. Because it's so common, you have to rule out other potential causes for the pet's symptoms first. Otherwise, you might blame Helicobacter when it's something else entirely.
Right. So what tests are available?
There are several tests that can sort of suggest Helicobacter is present. You can look at smears of the stomach lining under a microscope.
Just scrape the lining a bit?
Yeah, during an endoscopy usually. Use special stains like Gram stain or Diff-Quick. It's relatively easy, but it doesn't tell you the specific species.
Okay, see something spiral-shaped maybe?
Exactly. Then there's the rapid urease test. You take a small tissue sample, a biopsy during the endoscopy, and put it in a special gel.
And that urease enzyme we mentioned earlier.
That's the one. If Helicobacter is there and producing urease, it causes a color change in the gel. It's quick, easy to do right there.
Neat. What else?
There are also breath tests and blood tests, like the 13C urea test. They measure byproducts of the bacteria's activity. It's shown to be reliable in dogs. But it's not widely available commercially yet for vets. PCR testing can be done on biopsies or even gastric fluid to detect the bacteria's DNA.
TCR finds the genetic material.
Right. And blood tests, serology like ELISA, can measure antibodies the pet has made against Helicobacter.
Does that tell you if it's an active infection?
Not really.
Yeah.
It just shows exposure at some point, and again, doesn't identify the specific species. And vets often use special stains on the tissue biopsies.
Why special stains?
Because these bacteria can be hard to see with standard stains. Things like Warthin-Starry or modified Steiner-Silver stains, they really make the spiral shapes pop into the microscope. Helps visualize them better.
Okay. And what about just looking directly at the tissue sample itself, the biopsy?
You mean histopathology?
Yes.
Yes, that's looking at the tissue structure. Examining biopsies with those special stains is really considered the most definitive way to diagnose Helicobacter in the stomach.
The gold standard, sorta.
Kind of, yeah, for confirming presence in the tissue. But even that doesn't differentiate between the different species, remember?
Right. Still just tells you Helicobacter-like organism present.
Exactly. And routine staining, the standard H&E stain, might even miss the smaller organisms entirely.
Good to know. What about imaging? X-rays, ultrasound?
Usually normal. If Helicobacter is the only issue, you typically don't see changes on X-ray or ultrasound. Endoscopy, though, putting the camera down.
That can show things.
It might. You might see things like superficial bumps or nodules on the lining, thickened stomach folds, maybe tiny pinpoint hemorrhages, or erosions if there's significant gastritis associated with it.
Okay. And for the liver, if you suspect that H. canis...
Then you need liver biopsy. Again, use those special stains and maybe try to culture the bacteria from the liver tissue, though culture is generally difficult for Helicobacter.
Right. Tricky to grow. So it's often a combination of tests then, trying to build a case.
Definitely. History, signs, ruling out other things, endoscopy findings, biopsy results, putting it all together.
So if a pathologist does look at a stomach biopsy from a pet with, say, Helicobacter-associated gastritis, what kind of inflammation pattern might they see?
Typically in the stomach, a common finding is something called lymphocytic plasmacytic gastritis.
Meaning lots of lymphocytes and plasma cells.
Exactly. Specific types of inflammatory cells gathering there. And often you also see enlargement of lymphoid follicles, that immune tissue we mentioned. Interestingly, neutrophils, another inflammatory cell common in bacterial infections, are less commonly seen.
And ulcers. You hear about ulcers with H. pylori in people all the time.
Right. But gastric ulcers are actually not commonly reported in dogs and cats with Helicobacter. It's another difference from the human picture.
Interesting. Okay. And in that liver case, the H. canis hepatitis, what did that look like microscopically?
There you'd typically see evidence of liver cell death, necrosis, infiltration of mononuclear inflammatory cells into the liver tissue, and, of course, seeing the spiral or curved bacteria themselves, often located within the bile ducts.
Okay, within the bile ducts, that gives us a much clearer picture of the diagnostic side. Now, the big question, treatment. If a pet is diagnosed and is showing signs that fit, what are the usual strategies?
Yeah, this is where it gets, well, a bit complex. Because as we've been saying, we're still really learning about the exact role Helicobacter plays in causing actual disease in pets.
Big uncertainty factor.
Exactly. So there aren't really strict, universally agreed upon treatment guidelines like there are for H. pylori in humans.
So no single best practice yet?
Not really set in stone. First off, animals that have the bacteria found, maybe incidentally during an endoscopy, but aren't showing any signs.
Be asymptomatic carriers.
Right. They generally don't need to be treated. There's no clear benefit. and you risk antibiotic resistance. Makes sense. Treatment is usually only considered for pets that are infected or showing compatible clinical signs like chronic vomiting and where you've reasonably ruled out other potential causes for those signs.
Oh, okay. So only if it seems likely Helicobacter is the problem. I know in humans they often use that triple therapy. Is it similar for pets?
Yes, that approach, typically 2 antibiotics plus an acid-reducing drug, is the standard, highly effective model for H. pylori in people.
And in pets.
While it appears to be less consistently successful in actually getting rid of Helicobacter in dogs and cats, eradication rates aren't as high.
Less effective. How long is treatment usually?
Typically around 2 to 3 weeks.
And what kinds of drugs are used?
The antibiotics commonly used include things like clarithromycin, metronidazole, amoxicillin, sometimes as erythromycin or tetracycline, and often bismuth subsalicylate like Pepto-Bismol is included.
Bismuth. How does that work?
We actually don't fully understand its mechanism against Helicobacter in pets, but it's part of many protocols.
Okay. And the acid reducers?
Drugs like omeprazole, famotidine, or ranitidine are used to decrease stomach acid production, which might help the antibiotics work better and soothe the stomach lining.
Right. What about for that suspected intestinal or liver Helicobacter in dogs, the H. canis?
There, a combination like amoxicillin and metronidazole might be used based on limited information.
And sometimes if the gastritis doesn't respond and maybe they suspect underlying IBD, inflammatory bowel disease.
Yes, in some refractory cases, if IBD is suspected alongside the Helicobacter, vets might consider adding immunosuppressant medications. But that's a whole other layer of complexity.
Definitely. So the key insight on treatment is it's not as standardized, maybe not as reliably effective as in humans, and needs careful consideration.
That sums it up well. It's often a trial and error process to some extent.
So it sounds like treatment isn't always a slam dunk. What should pet owners expect after their pet has been treated? How do you even know if it worked?
That's another tricky area. Unfortunately, those blood tests, the serology, looking for antibodies, they aren't very helpful for confirming eradication.
Why not?
Because antibody levels can stay high for a really long time, months even, after the bacteria are gone. So a positive test doesn't mean the infection is still active.
Okay, so blood tests are out for follow-up. What about that breath test, the 13C urea test?
It is being studied for use in pets to monitor treatment success, and it might be useful in the future. But again, not widely available right now.
So what's left?
Well, if the pet's symptoms continue, or maybe they get better and then come back after treatment.
Or relapse.
Exactly. Then a repeat endoscopy with another biopsy might be necessary to see if the bacteria are still present and if the inflammation has improved.
Go back in with the camera and take another look.
Pretty much. And it's really important for pet owners to be aware that relapses can happen. Studies have shown that the bacteria can sometimes return even after apparently successful initial treatment.
Ugh, that potential for recurrence is a bit concerning, isn't it?
It is one of the challenges, yes. We don't know if it's true reinfection or if the treatment just suppressed the bacteria temporarily.
Is there anything pet owners can do to help prevent these infections in the first place?
Based on what we know about those risk factors we mentioned.
Overcrowding and sanitation.
Right. So the main preventative advice is trying to avoid situations where pets are really overcrowded and just ensuring good general hygiene and sanitation practices. Basic stuff, really.
Okay, so good basic hygiene, like always, seems sensible. So just to kind of bring everything together here, after this deep dive, what's the most important thing, the main takeaway for us to understand about Helicobacter in dogs and cats?
I think the main takeaway is this. Helicobacter is, well, incredibly common in both dogs and cats. It's frequently found.
Right, very prevalent.
But its actual role in causing illness is complex. It's still under investigation. Just finding these bacteria doesn't automatically mean that pet is sick or that the bacteria are causing the problem.
So unlike the clearer picture in humans with H. pylori.
Exactly. The situation in our furry friends is much more nuanced, much grayer. Diagnosing a Helicobacter-related problem requires really careful consideration, ruling out other causes, and looking at the whole picture. And finally, treatment can be challenging, and recurrence or relapse is a possibility we need to be aware of.
So, bottom line, presence doesn't equal disease. It's not necessarily a reason to panic if it's found, but it's definitely something vets consider, especially with chronic GI issues.
Precisely.
And given how much we're still learning, what areas of research do you think would be most helpful? Where do we need more information to really understand Helicobacter's impact on our pets?
Oh, that's a big question. Better ways to determine pathogenicity, which species are bad, under what conditions. Better diagnostics to confirm active infection and eradication. Understanding transmission better.
Yeah. And maybe what questions should pet owners be asking their vets if Helicobacter comes up? If it's suspected or found, is this likely the cause? What else could it be? What are the pros and cons of treatment for my pet?
Those are excellent questions. It really sounds like there's still quite a bit to uncover in this whole area, doesn't it?
Definitely feels that way. Lots more to learn.